Hi, I'm Dr. Charles Briscoe. Call me Charlie. I've been in practice since 1980. I decided in my second year of high school to become a dentist. I had great experiences at the dental office as well as at my orthodontist office, and I'd like to think that we provide pleasant experiences for our patients. I enjoyed the opportunity to work with a wonderful group of people that are our patients. Each patient has their own story, so we get to know a lot of individuals. I also have the opportunity to work with a wonderful group of ladies that are my team that help us treat these patients. They also take good care of me. The mouth is the gateway to the body, so signs and symptoms of systemic disease may well show up in the mouth, and we need to be able to detect it. Likewise, we have to be able to control the plaque and gum disease and decay so that our patients don't get into a higher risk situation for diabetes, stroke, cardiovascular disease. So what we do is very important, particularly with our aging population. We treat a fair number of people with worn teeth that have chipped and fractured and worn away over the years and are short and don't have a very good appearance. So we have the opportunity to work along the lines of reestablishing their bite, getting that healthy, and at the same time, the patients get into the aesthetic value of our treatment. They focus mainly then on how their teeth look, the shade, the color, the shape. The appearance of the teeth become the patient's main focus. And we go ahead and get the bite healthy so that the gums and bones stay healthy, and the patient gets a wonderful smile. Doesn't get any better than that. I'm in a continuing education course of one type or another every month. And I'm constantly reading journals, articles on the internet about clinical dentistry. The materials, the techniques seem to be constantly changing almost on a daily basis. So you really have to work at trying to stay current, or else you become ancient history. Biggest challenge really is to get the information out to the patients so that they know what's available to them. Each patient is an individual and they have their own unique sets of desires and needs, and it's up to us to create a customized treatment plan for them so that they can attain that ultimate level of health, function, and aesthetics that's appropriate for them at this point in their life. Folks simply don't know what's available to them. We don't prescribe the one-treatment-fits-all type of treatment for patients. We're particularly proud of the trust that we've earned from the patients. Patients bring in their significant others and ask us to upgrade their mouths to a higher level of health, function, and aesthetics. That's very exciting for us. And it's not just the wives bringing in their husbands, it's husbands bringing in their wives. Recently we had a wife bring in her significant other. Recently we had a wife bring in her husband. She's a few years younger than he is, and she wanted to make his smile more youthful. At first I thought it was all her doing, but once we got into the case, I realized that he was really involved in this also. We worked through several procedures, and by the time we were done, he had a smile that was 10 to 15 years younger. He was quite happy, but she was ecstatic. It was really overwhelming, the results that they saw and that we felt.